welcome to this group coaching. In this call, I'm going to be answering your questions about Ontake, and I'll be discussing my new teaching video on how to treat anxiety. I'm Oran Kivity, author of MOXA Emotion, and a teacher of Ontake Warm Bamboo, this amazing MOXIBUSTION tool. So if you can hear me and see me loud and clear, please hit the like button, or if you want to make me really happy, hit the wow face. I'm going to be talking about anxiety a little bit today because that's on everybody's mind. Hi, Eric, good to see you. Luca, good to see you. Antoine, so great. Looks like there's quite a few people here and some familiar and love faces as well. So great to see you guys. I can see hearts and wow faces and smileys and thumbs, so that's great. Let's talk a little bit about anxiety. When people are anxious, their nervous system is a little bit jangled. So our role as acupuncturists and MOXIBUSTION practitioners is to de-jangle them. We can do that in very simple ways. I mean, just with what you normally do, of course, is going to reset the system. But one of the things that is really effective for anxiety is the bamboo mini treatment. And by bamboo mini, I mean working on the upper back on either side of the spine, from the top all the way down to the bottom of the back. So a very simple treatment, just balancing kyo and jitsu in the bladder channel on either side of the spine. Now, one of the things is that when people are jangled, if you imagine a spinning top which is spinning round and round and round, it tends to wobble a bit, and it starts to angle over and wobble over. So the kind of nudge you want to give to a spinning top needs to be very minimal, because if you give it a really big nudge, you'll push it over the other way. So in other words, when we're dealing with people who are anxious and we're dealing with people who are unusually sensitive, so by that I mean that they might not normally be sensitive patients, but today they are. So in a sense, because of what's happening around the world, we are all becoming more sensitive because we're under this constant worry of stress and infection and what's going to happen to our practices, what's going to happen to the world. So these are big concerns for all of us, not just practitioners, but for our patients. So that means that less treatment is advisable. So that means that when you're doing the bamboo mini treatment, you should be reducing the time, and you should also be reducing the intensity with which you give it. So instead of rolling really hard on the back and kind of doing lots of very strong things on the muscles, you should be working very lightly. So I think that's the main thing to consider, is that because the system is more jangled, you want to do less of an intervention. And those are the two main things I want to say. But bamboo mini is a very comforting treatment, and you can work on the shoulders as well, which we're going to get very tight. So work on the shoulders at 120 beats per minute, work on either side of the spine at 112 beats per minute. Keep things short, shouldn't really last more than 5 minutes at a maximum. If they're having a lot of problems with sleeping, then you can work on the legs as well and finish on the feet, particularly on the soles of the feet. So on shitsumin, which is in the center of the heel. If this is my foot, it's in the center of the heel. And also you can work on kidney 1, or just roll on the sole and then press the toes with the bamboo consecutively. So those are the kind of things you can do, particularly if there's a lot of energy in the head and people are not sleeping. But remember to keep things short and simple and sweet. Okay, so, yeah, please do start to type in questions if you have any, and then maybe what we can do is have a kind of informal watch party on the video in YouTube. Okay, whilst I'm waiting for a question, then I'll talk a little bit about the video that I've just done. I'm going to put the link into the chat. and that link should be premiering right now on YouTube. So if you click that link, you'll be able to see a short demonstration of Bamboo Mini, and also Fukaya's anxiety points. So whilst I'm waiting for a question, I'll talk a little bit about Fukaya's anxiety points. Okay, Michael, thank you. I've seen your question. So yeah, let me talk about Fukaya's anxiety points. This is a string of points, 5 do-my points, which start at T3, just below T3 on the spine, and go down all the way to T9. And Fukaya had a method where he would palpate down the spine and look for tender points. And then he would burn small cone MOXIBUSTION cones and release the most tender of those. And what I have done is I've developed a variation that you can do with Ontake using Fukaya's anxiety points. So the routine is very simple. You just work your way down the spine with a pen in one hand and mark any points between T3 and T9 that are tender. And if there are 2 or 3 points, then ask your patient which is the most tender of those 3 points, and start with that one. The next thing you can do is lay the Ontake on its side and tap at do my frequency. So the do my frequency is 104 beats per minute, and just knock on that point with the bamboo lying on its side. If the bamboo feels very hot, then make sure that there's a cloth or the patient's t-shirt between the skin and the bamboo. But if it's not too hot, you can just knock. And knock for a few beats and then test the sensitivity again. And normally that will be enough to release the point. And if you've released the most tender point, then the other points will also release as well. But you can clean them up as well. You can just go up and down the spine and make sure that all those reactions have cleared. So that's a very simple way to relieve anxiety and also to treat insomnia. Fukaya's anxiety points. That's demonstrated in the video that's just come out on YouTube. So the 2 things that are on the video are how to treat Fukaya's anxiety points and how to do Bamboo Mini lightly when someone's feeling anxious. Okay, I'm going to scroll down and I'm going to see that there are some more questions. So Michael, can you speak more to harmonizing and adjusting a person's constitution? What are your thoughts on this kind of approach? Okay. By harmonizing and adjusting a person's constitution, I'm guessing you're talking more about the kind of what people have inherited from, in life. So what is their constitution? So maybe in 5 element terms, are they a lung constitution or are they a kidney constitution? So how can we adjust those things? And how can we adjust those things with Ontake must be specifically your question. So I'm not sure that I can answer to working with constitutional energies in a 5 element kind of way with Ontake, because I've not done that and I don't know of anyone who has. What I can only talk about is regulation. And our job now is not to say, oh, I've got to do points that are good for immunity, or I've got to do points that are good for anxiety, but our overall goal should be regulation of our patient's whole chi and blood system. So that means, in Ontake terms, balancing Kyo and Jitsu in the channels. So when you're working, if you're going to do a whole body root treatment with Ontake, then you want to be balancing Kyo and Jitsu in the channel. So if you start off working on the large intestine channel and you find that there are areas that are deficient and areas that are excess, that's what you need to work on, because that's going to have a holistic effect on the chi and blood flow in the whole body. So I think that's the main thing I would say is work constitutionally by working locally. This is also, in a way, part of what Dr. Tan was saying when Dr. Tan did Tan balancing. He was saying find the sick channel and then balance the sick channel. So that's what we also do when we adapt those principles with Ontake. So thank you for that. I hope that answers that. Joe, if you are treating anxiety, would you do just that? I mean, you wouldn't be working on pain issues, for example, in the same session. Okay, I think that's a good question. You've always got to think of this spinning top analogy. In other words, small nudges. Now, if you're saying, I'm going to do something for your pain, and I'm going to do something for your digestive symptom, I'm going to do something for your anxiety, and I'm going to do something for your sleep, that's 4 nudges. So that's too much. So I think that you always have to have a very clear objective when working with patients, whether you're working with Ontake or with acupuncture. So the key role of acupuncture, as far as say, for example, in the Toihari Association, is your job is to regulate qi and blood and to work on the root level to balance the flow of qi and blood. In Toihari, you do this by deciding on a fundamental weakness, the weakest link, if you like, which is what in Toihari they call the sho. So we work on the kidneys, or we work on the lungs, we work on the spleen, etc. And then after that, you do some branch treatment. Now, you can't do too many branch treatments. You have to really choose your focus. So in answer to your question, Joe, I would say yes. Keep things as simple as you can. If someone's coming for anxiety and they have some pain, then maybe you can do things that are good for both. Now, you know that Ontake itself is really good for calming the patient down. So it may be that your pain treatment, you can also say, is going to calm them down, and that's what you're going to do for anxiety. Or it may be that you choose to focus more on the anxiety, and then you do bamboo mini or Fukaya anxiety points instead, and you just let the root treatment take care of the pain. So yeah, in answer to your question, try and focus on one issue for branch treatment, and stay focused on that, rather than doing lots of branch treatments. I'm going to do a bit for this and a bit for that and a bit for that. So you're not making salad dressing, you're making a wholesome soup. Yeah, Luca, when I use specific points, do I need to use the frequency of the organ related? So for example, when I do bladder 52, should I use kidney frequency? Okay, that's a good question. And I think Manica did sometimes tap when using the hammer. He would change the frequency according to the point below. So for example, when tapping on bladder 18, he would say tap at 108 beats per minute, even though it was on the bladder channel. So you can vary that, but remember that Ontake is not a hammer. When you're using a wooden hammer, you're tapping very much point by point, and the focus of the wooden hammer is very direct on an acupuncture point. So you can think of that as like an artist who's painting with a fine brush on a canvas. But Ontake is not like that. You're more like a decorator painting on the surface of a wall or a ceiling with a roller. So you're not going over points, you're going over regions and lines. So for Ontake, I would say that your focus should be more on the frequency of the channel, but occasionally you can consider to do the frequency of the point. For example, as in the example I gave, bladder 18 at 108 beats per minute. So that's what I would say is stick to the channel frequency as your default frequency. And if you want to treat points, then you can consider, if you're doing a technique which is very point focused, like rocking, this technique, rocking, where you place the base of the bamboo on the point and then you rock from side to side or around. then you can consider to vary the frequency according to the point indications. Yeah, thanks for that. Okay, Eric. Okay, so any advice to leave an insisting point? Insisting, he means a point that looks like to stay there. So I think, Eric, if I understand your question correctly, you're saying, what do you do with very stubborn points? So you're working on an area and it doesn't clear. I hope that's what you mean, so I'm going to try and answer that. So it's inevitable that when you work up and down the body, that you come across stubborn points, points that don't soften. Or maybe they soften a bit, but they don't soften as much as you would like. So there are two things to consider. The first is that you don't have to be Gandalf and achieve magical results every time with every patient right away. So if there's a point that has changed substantively, so maybe your hope, it feels like 100% tight, and then you work on it and it's 70% tight, that might be good enough, given the other things that you're doing. But sometimes you feel it's just really not changing. And then in that case, I would, with a really stubborn point, there may be other techniques that you can do. Now, Manika talked a lot about stretch MOXA, like channel stretches. So for example, you stretch the triple burner channel, let me demonstrate this way, by stretching the third finger, and then you look for a tender point somewhere along the triple burner channel, and you put small cone MOXIBUSTION there. So in the book, I talk about variations of these techniques that you can do with Ontake. So if there are very stubborn points that are not responding to Ontake with you rolling directly on them, then you can do Ontake in another way. You can do stretch MOXA, or you can do distal Ontake to try and relieve them. Also, certainly from a Toihari perspective, stubborn points will get softer once you've done root treatment. So if you've done a really good root treatment, like a whole body balancing treatment, then those stubborn points will change somewhat. So that would be my advice. First of all, don't be too hard on yourself if things don't change. Things change slowly over time, and maybe when they come back the second time, things will look much better. The second thing is you could do an alternative method, for example, stretch MOXA or Sotai, described in the book under the Manika chapter, or distal Ontake, described in the book in the Dr. Tan chapter. Or it might be, and sometimes I think, you know what, Ontake is not working today on this particular point. What it needs is, and then maybe it will need small cone MOXIBUSTION, maybe it will need cupping, maybe it will need bloodletting. So if it's a really, really super stubborn point and Ontake is not getting in there, you can also consider that Ontake might not be the right the right tool for that job at that time. Okay, thank you. That's a really good question. Okay, Marta. Marta, you've got a question. You just say, so with patients that are too much sensitive. So if I understand your comment correctly, you're saying, how do you deal with patients who are really super sensitive? Okay, so that's something that we discussed when I saw you in was it in Barcelona? Yeah, in Barcelona, and also when I talked about sensitive patients. So there are patients who come along who are just so sensitive, there's almost nothing you can do. And I think you have to be very careful with them. So in the book, I talk about the jitsometer, and when I teach, I talk about the jitsometer. And the jitsometer is an imaginary dial that you have as a kind of thought experiment. I wonder if I've got an image of a jitsometer that I can share with you. No, I can't do screen sharing here, and I don't think I want to try, given my level of technical expertise with Facebook Live. Yeah, so the jitsometer, if you just imagine that you have some kind of gauge, and here is a very robust patient, and here is a very sensitive patient. So most sensitive patients are around here. At this particular time, they're going to be more around here at the kind of very lowest ebb of sensitivity. So you need to be very careful with those kind of patients. So I still think bamboo is a really good tool for sensitive patients. So fewer needles, more bamboo, but all the light techniques with bamboo. So for example, you're going to do touching or tapping rather than knocking. You're going to do very light rolling as opposed to deep rolling. Andrew in the group has been talking about having some bamboo, which have got, he's designed them with the, I haven't got one here, it's at the clinic, but he has some bamboo where the knot is in the middle, so it makes it like a rim. So when you roll with that, you're getting a kind of focused pressure on the bamboo, on the knot of the bamboo. So he's cut the bamboo around the division between the chambers of the bamboo. So of course that is more strong than using a flat bamboo. So you can see that even within the tools you select, you can choose to use ones that are milder. So I would say that working with a focused bamboo like that is stronger than working with a flat one all the way through. You can also consider to work with a smaller bamboo for sensitive patients. I think in the book I described one of my really super sensitive patients, and I was working around her eye, and she couldn't stand it when I used to come with the big bamboo around her eye. So then I started to use the little one. So then she was much happier, and she didn't get the same counterflow chi reactions when I did that. So those are all things that you can consider, Martha, for patients who are really too sensitive. Reduce the dosage, the treatment time, and reduce the kind of techniques that you do with bamboo. Use smaller bamboo sizes, and if you want, put a cloth on the skin and do bamboo through the cloth to reduce the heat. So those are all ways to mitigate the dosage with sensitive patients. If you look in the comment stream, and I can edit this bit out of the video on YouTube, is I'm going to paste a link here in the comment stream, and that link takes us to YouTube. So there's basically, I've done a 7-minute video which demonstrates how to do bamboo mini and how to do Fukaya anxiety points. And can I suggest to you all that you take a look at it now, and then if you have any more questions, just put them in the live stream. So I will go quiet for 7 minutes or so, and I'll watch myself on TV, and then after that I'll come back to this chat and we can get some more questions. So Michael, you're saying that you think you've been using too much pressure, and I think that's probably true. Is that when you read about techniques, then it's not the same as seeing them, and I think that's what we're going to be trying to do a lot with our online trainings. No, you can't. Off you go. Sorry, I've got a cat and I left the door open during the video. So yeah, one of the things we have to consider is how to teach Ontake at the moment. So all the classes in the US have been cancelled, in Brazil have been cancelled or postponed, in Indonesia have been cancelled, and I don't know what will happen to the classes in France and UK, which are due to take place in November. So one of the things I'm trying to do is to do a live stream with Geological, and that will use kind of material like what we've just been seeing, and lectures like this and talks like this, so that we can try and get this material across, but yeah, without meeting. But we'll be giving you a lot more information about that in the future, in the days and weeks to come. And we hope to do not just a live stream, but also CPD kind of course, which will yeah, to help us all to do Ontake. It's funny, I mean, looking at that video, it was only done on like 3 days ago, but it feels like another era. I look back at my clinic room and I'm treating patients, and you know, I've been on lockdown in Malaysia, and we're not supposed to be going out of the house. So it just feels like another era. Yeah, times have changed big time. Okay, Sa'al, okay, your question is, would you do this as part of a whole acupuncture treatment, or possibly an add-on, or would you do it as a singular treatment? Sa'al, that patient I had just already done acupuncture with. So I had done root treatment with meridian therapy with Toyohari. And after that, I finished, when she'd been working on her back, lying on her back, I asked her to turn over, and then we did the sequence that you saw. So yes, very much so that you should integrate Ontake into the way that you work, rather than thinking of it as a standalone treatment. So this is how to use Ontake. Usually 5 minutes at the end of a treatment, or 5 minutes in the middle of a treatment, kind of integrated into what you're already doing. So thanks for that question. It's a good idea. Joy, I hear you that my voice is echoing. Is that a problem for anyone else? Oh, okay, great. You opened 2 windows. All right. Are there any other questions that you guys want to ask? If there are no more questions, and I can't see any more in the stream, then I think it would be time to wrap up the coaching call. Yeah, it seems like there are no more questions. So what I'd like to say is that I'd like to thank people who have already bought the book, and I really appreciate that. Is it? Okay. I really appreciate that. There's a couple of things that I need help with, and that is for you to keep an eye on this group in the coming hours or days. I'm going to ask you for information about your local acupuncture magazines in your country, because it's time for me to start contacting acupuncture journals and magazines and offering them review copies of the book, so that it can go out to a wider audience. So can you suggest any journal that you read in your language, in your country, who I could contact with a view to getting a review? So that would be really helpful for me. And what I'll do is I'll set up a form in the Ontake group for you to put that information down. So maybe the name of the journal and an email for the journal, if there's a journal that you read. So in the UK, obviously, I'm aware of EJOM and the JCM. In the US, I'm not sure who I should be contacting. In France and Spain, I have no idea. In Brazil, I have no idea. So if there are any publications that would review the book, then please let me know their details. And if you have a contact name, that would be great. I'll set that up as a thread after this call. And also, if there's any feedback on this coaching call, that would be great. So thank you very much for watching. Go with love, go with safety, and I'll see you soon.